name is Dr. Hetal, and I'm a board certified practicing OBGYN in New York, New Jersey area. And the reason for this video is to talk to people, that way we get some more understanding of COVID-19 virus. I have got COVID virus. I'm COVID-19 positive. And the amount of knowledge we have is so limited and it's evolving. What we knew in February to what we knew in early March to now end of March, what we know. Firstly, what symptoms I had and what I have talked to people. The symptoms starts off by feeling very tired, exhausted. You really want to lie down. You feel like you're drained of your energy. A little bit GI upset, either diarrhea or feeling nauseous, followed by loss of taste, loss of smell. This prodrome period can last anywhere from 2 to 3 days, followed by high-grade fever, cough. You could have runny nose and shortness of breath. What is shortness of breath? Shortness of breath is like gasping for air, either when you're talking with somebody or you're walking around, what you could usually do, but now you climb few steps and you are gasping for air. That's shortness of breath. I developed all those symptoms on third or fourth day, as I think, but that's the only time you can be certain, when there's a fever and stuff, that maybe you do have COVID-19. I think it's important to know this prodrome and early symptoms, so that way you isolate yourself, you quarantine yourself, especially if you are somebody who is out and about, because that's kind of work you do. So me, as being a physician, as soon as I stopped seeing patients. I isolated myself in the room to avoid my family members getting infected. Keeping bed rest, drinking a lot of water. Luckily in my office we did have the pulse ox machine, which tells me what's my oxygenation as well as my pulse rate. I think that was like a lifesaver for me, because I could see if I was doing fine or I needed to take some deep breaths and open my lungs up. There was one night that my temperature was 102, my pulse was 140, and my saturation was 93. I waited out, I took Tylenol, and I was almost about to go to the ER, but my numbers improved and I felt better. Luckily, I had some hydroxychloroquine in my house. I was supposed to go to India to visit my mother, so I had some hydroxychloroquine for malaria prophylaxis. So I started those medication. One warning, please don't self-medicate. Let your physician decide, because I know my health. I didn't have no cardiac risk factors, etc. So I could take that. So I did start taking the hydroxychloroquine. I would say within 48 hours, I broke my temperature, the chills and feeling of that weakness kind of started improving. The cough and the shortness of breath did continue. But after second and third day, the fever kind of came down. After that, it takes long time to get your energy back, your taste back. The GI symptoms kind of disappeared. The cough and shortness of breath does continue. So this is in short what has been happening now. Today is my day 9, day 10. I'll keep everybody updated what happens. I was to make a video about COVID-19 and pregnancy and talk about that, but before that I got this, so I want to educate people with this first, and then we'll talk about pregnancy and precautions in pregnancy and childbirth. Thank you. This is Dr. Hetal.